Jimmy Carter's quiet but monumental work in global health. Jimmy Carter's 5 decades of leadership in global health brought a hideous disease to the brink of elimination, helped to deliver basic health and sanitation to millions of people, and set a new standard for how aid agencies should engage with the countries they assist. It was quiet work and drew relatively little attention because it was focused on afflictions that plague the poorest people in the most marginalized places, but it had enormous impact. The work in global health may turn out to be some of the most important work that he did, said Dr. William H. Foge, who helped lead the successful effort to eradicate smallpox in the 1970s and played a key role in drawing the former president into the field of global health after he left office. Mr. Carter, the former president who died on Sunday at age 100, saw his healthcare work through the prism of a larger effort for basic rights and as a tool for peace building. We believe access to healthcare is a human right, especially among poor people afflicted with disease who are forgotten, ignored, and often without hope, he wrote in 2001 after a trip to lobby Latin American leaders on neglected diseases. Just to know that someone cares about them not only can ease their physical pain, but also remove an element of alienation and anger that can lead to hatred and violence. He used his rare status as a former head of state to lobby presidents and prime ministers on behalf of their poorest citizens. He and his wife, Rosalynn Carter, trekked to remote corners of countries including Chad and Ethiopia to visit and comfort the sick. Then they traveled back to capital cities where in private meetings or, if those did not produce results, news conferences, they pressed for action on behalf of those same people. Mr. Carter negotiated a ceasefire in Sudan's decades-long civil war so that teams working to wipe out a parasite could reach civilians, and he brokered a major drug donation program that has been key to progress in eliminating river blindness, another scourge. The Carter Center, a nonprofit that Mr. and Mrs. Carter founded in 1982, is admired in countries where it provides development assistance as an organization whose beneficiaries set priorities and led projects, an ethos that former staffers say originated with the Carters. Dr. Foge was the director of the Centers for Disease Control and Prevention during the Carter presidency. Not long after Mr. Carter left office, he called Dr. Foge and asked him to run the Carter Center, through which he hoped to work on conflict resolution and advance democracy. Dr. Foge said he told Mr. Carter that there were so few people working in global health at that time that he could not imagine leaving the field. A couple of days later, he called me and he said, "Would it make a difference if I became interested in global health?" Dr. Foge said. And that's exactly what happened. And he became so interested in it, you could not give him enough material to study. He became better at global health than almost any global health person I know. Mr. and Mrs. Carter decided to focus on neglected tropical diseases, which draw little investment in research or treatment because they infect the poorest people in the poorest countries. He would often ask, as we were trying to brief him on a new area that we were working on, "Who else is working on it?" Dr. Foge recalled. He said, "If there are other people working on it, you don't need me." In 2001, Bill Gates and Melinda French Gates consulted Mr. Carter when they were establishing priorities for the charity they had just set up with the world's largest endowment. Mr. Gates said that the former president urged them to expand their work in global health. Mr. Carter's encouragement, Mr. Gates said, helped dispel skepticism he had about the public health field. When you look at it and say, "Why isn't anybody working on these things?" then you think, well, maybe it means that it's just impossible because of the corruption or delivery, Mr. Gates said. Jimmy and Bill Foge said, "No, it really can work. You can get this stuff delivered." Mr. Carter arranged key introductions to African leaders, Mr. Gates said. He noticed that while the Carter Center was working in many countries, it did not have its name displayed prominently on projects, and instead foregrounded the work of local leaders. In 2004, the Carters came to Togo because the guinea worm program was not getting the cooperation from the government that the center needed. Dr. Sodalan, then a young medical officer, was asked to MC an event to welcome them. The President and the First Lady came down to Lomé to see the high-level officials, and of course, when he reached anywhere, everybody's shaking, I can tell you. That's his power, Dr. Sodalan said. Members of government who had been botching guinea worm eradication suddenly had to explain to the country's leadership why a former U.S. president was arriving in search of answers. That's how he worked. His name alone made every leader, every high-level politician in every country shake, Dr. Rosalynn said. He had two tools: grab his phone and call the leader. And if not enough, take a plane and go to the country. Carter Center beneficiaries receive anti-parasite drugs once a year, and that might constitute their entire interaction with the health system, Dr. Rosalynn said. They are people who are voiceless. They are suffering in silence. They are not bothering any politician. They have no political power. Not to the Carters, he said. They had power, he said, and they knew how to use the power to alleviate suffering from those who needed it most across the world.